Hi, I am Dr. Harikrishnan, Professor of Cardiology at Sri Chitra Institute and President of the Heart Failure Association of India. I welcome the initiative by Times of India to spread the message about heart failure. As you are aware, heart failure is an emerging public health issue where 1 to 2% of the total health care expenditure in the Western world is channeled towards this disease. Data regarding heart failure is emerging from India from various ongoing registries. We are currently running the National Heart Failure Registry, supported by ICMR, where we have recruited more than 10,000 patients. The study shows that Indian patients are younger by 10 to 15 years and males are more affected. Ischemic heart disease or heart attack related diseases is the reason in 70% of the patients to develop heart failure, followed by dilated cardiomyopathy where the heart muscles become weaker. Valve disease, especially rheumatic heart disease, contribute to 6% of the burden of heart failure. What is evident from the registries is that the intake of evidence-based drugs, that is the drugs which have been shown to benefit in patients with heart failure, is given fully in 40% of the patients. The data also shows that the mortality, the death rate is higher in Indian patients. 1 year mortality is 30%, that is 1/3 of the patients die at 1 year and 2/3 of the patients die at 5 years. This high mortality is higher than many common cancers like breast or colon. We know that in a country like India where resources are limited, it is difficult to treat heart failure because heart failure treatment is resource intensive. So the best way to tackle this problem is to prevent the development of heart failure. How can we do that? Timely treatment of heart attacks, treatment of hypertension, treatment of diabetes, stopping smoking and having a healthy diet and regular physical activity will bring down the development of heart disease, which in turn will prevent development of heart failure. So I should emphasize that the way to address heart failure in India is to prevent it, as treating the huge number of patients will be difficult for an already burdened healthcare system in India. So prevent heart failure. Thank you.